in the end, what we're looking for is that somebody can really kind of travel inward and come into a region of the body. And I think this is where it's slightly different, this approach, than those of you who've taken any kind of mindfulness meditation class. You know, there's often, almost always, there's this introduction to interoceptive awareness is often through attending to the sensation of the inhale and the exhale of your breath as a way of bringing you internally attending to those sensations, right? But what we do is we're moving attention into very specific regions, and they could be any region of the body. So mindfulness meditation often uses that as sort of the intro, but doesn't really extend beyond that. We're helping people to bring awareness into a region, but it could be any region. So we'll do this for a moment together right now. If you feel comfortable, just again, taking a hand, it can be any hand, and let's just place it, your whole hand, like very firmly, spread your whole hand across your chest so you really feel it, and take a minute and think about what level of pressure feels really comfortable to you. So you might lighten and heavy and lighten and heavy, kind of feel around until it's just right, that sense of really holding yourself in a way that feels comfortable. And then just allow your hand to kind of move around. If you're on skin, it'll be a little easier. And note how much movement is in that tissue. Just notice how this region feels underneath your hand. Is there a sense of movement? Is it fluid, or is it not? Do you have a sense of hardness or softness? Like just kind of notice those kind of descriptive things about it. And then if you feel comfortable doing so, if you could close your eyes. And now what I'm going to invite you to do is to really, again, bring your attention to where your hand is on your chest. And really let your thoughts get very, very quiet. So you're just bringing your attention to right where your hand is on this part of your body. And then allowing your internal attention to drop into this space behind where your hand is, right in the center of your body. So for some people, the easiest way to do this is to have this idea of traveling your attention out of your head and down through your neck and into that upper region of your torso, in this space in your chest between where your hand is in the front and where your back might be touching the top of the chair. So you're wanting to land your attention right into this center space of your body. And just see if you can gently facilitate this movement of your attention, dropping right into this region. And then see if you can really just notice how it is to be here. And whatever you notice about being in this space inside. And if your mind starts to think or be distracted, come back to where your hand is as a way to help you come back to this internal place inside. And just notice in this space, again, how it feels to be here, and anything else you notice about being connected inside in this region. You might notice how you feel inside kinesthetically. You might notice how big or small the space feels inside. You might notice any kind of visual or emotional content. And just note whatever you notice. And if you don't notice much, that's fine too. And now we're going to, with your eyes still closed, bring your attention gently out of this space into your hand, which is still gently holding this region. And again, move your hand around like you did at the beginning. And just note whatever you notice about how it feels still to be holding this place, how the tissue feels when you move your hand around. And then you can slowly release your hand and open your eyes when you're ready. So this is very much just a taste of what we're doing, but we're helping people in this next phase learn to bring attention in. And as a therapist, this is really basic fundamental skills. The work is really teaching it. Because if you're working with people for whom this is challenging, brings up emotions, brings up barriers to being present with themselves, for example, or they're just having trouble getting in. They don't even know how to bring their attention down, or they're trying to, but they can't get beyond here, for example, if you're going to the chest, right? There's so many things that come up that make this really hard for people. And the art of the work is the teaching piece. The art of it is really helping someone learn these skills to be comfortable enough doing that to tolerate whatever they're experiencing. So it's a slow process. And hearkening back to the question that came earlier about, places in the body that might be difficult to go to, and is that just amplifying that? We really start this in the areas that are easier for people, so that they can feel successful. They can feel like, oh, now I know what that means. Now I know how to do it, right? And so you have to choose, you have to find places that they can.
Hi, I'm Liam Bloom with the United States Association for Body Psychotherapy. In challenging times when stress and anxiety run high, nurturing your body, brain, and mind is more important than ever. Maintaining presence and equanimity depends on your capacity to mindfully align sensations, emotions, and thoughts. These short somatic exercises, generously offered by our members, teach you how to use your energy, emotions, and awareness so that you can face challenges with confidence and step into your life feeling connected and empowered. Use them for yourself and with your clients.